My name is Adam. I come from California. I've had a herniated disc in the L5S1 for at least the past 14 months with sciatic symptoms and spinal stenosis. The extent of it has varied from time to time, with the worst times being where the pain goes down the leg into the foot with weakness. At the worst times, I was unable to really walk much or stand much or sit at all. For the past year, I've been avoiding sitting and anything that could potentially exacerbate the problem. I had some good, significant relief by doing yoga and physical therapy, but I've done yoga almost daily for the past year. Lost another 5 kilograms and done the best I could to avoid positions that could exacerbate the injury. Nevertheless, the injury got re-exacerbated, and it made it so I couldn't do a lot of things for the past 2+ months, plus an increase in pain. I had consulted several orthopedic surgeons, as well as regular medical doctors. Sent them my MRIs, and I got different answers from different people, with some of them saying that I almost definitely need to get surgery, and then another one saying that I definitely should not get surgery. So in that confusion, I didn't get surgery, and I did not want to get surgery. I did everything possible to avoid doing surgery. Then I had one doctor, and this is in Vietnam. This doctor is an orthopedic surgeon from Venezuela. He was in the camp of not wanting me to do surgery due to long-term risk of further degeneration and some other issues. However, he referred me to a company called Regenix, which he said is doing stem cell injections and PRP injections, which he said, unlike surgery, would actually potentially heal the issue, and that they're in the U.S. He knew I was coming to the U.S. for a couple weeks to visit. I contacted Regenix, made an appointment with one of their medical doctors. That doctor examined me, and he told me that doing surgery is a reasonable solution, and he also had recommended that I could also try PRP injections. He said stem cell injections were not an option with the size of my herniation, that it could push the herniation out even further. So he said that he had worked closely with Dr. Ditzworth and gave me his number. And I made an appointment, a consultation with Dr. Ditzworth, and had the surgery with him. Now, before making that consultation, I had also told other people, including, I guess, my mother and her husband, about my issue with my back, and her husband had surgery, which he says was successful, with a surgeon who works for USC, and they made an appointment for me to consult with him. So I consulted with him prior to consulting with Dr. Ditzworth, and he recommended that I could consider getting a minimally invasive discectomy. I asked him if he does the endoscopic procedure. He said no. So I think the other one is called microscopic. So he only does microscopic, not endoscopic. He didn't really volunteer the information, but from my research on the internet and talking with other doctors, I asked him if he has to remove any bone. He said yes, he has to remove, I think he said about 2 millimeters of a bone, but it's no big deal. It's not going to cause any instability issues. So then with the consultation I had with Dr. Ditzworth, and he mentioned specifically that in his opinion, professional opinion, that it is a big deal. And he also mentioned that orthopedic surgeons and a lot of surgeons, with as brilliant as they are and as much good as they do, that they are very slow to come around, that they're very, very quick to just say, oh, it's just a small amount of bone, it doesn't matter. It's not going to make a difference. So it made sense to me what the Dr. Ditzworth was saying, and I moved forward and proceeded. So far, it's only been about 12 hours, so I can't comment on how I'm doing long term, but so far, doing fine.